Hi, it's Dr. BCW. Let's talk about sickle cell and some myths associated with it. Sickle cell disease, also referred to as SCD, affects approximately 100,000 individuals in the US. This genetic disorder affects the shape of red blood cells. Instead of being round and flexible, the red blood cells become rigid and take on a crescent or sickle shape. This crescent-shaped blood cell does have the benefit of providing natural malaria immunity. Unfortunately, it brings severe negative symptoms as well. For instance, the sickle-shaped blood can cause increased clotting. When this happens, blood cells clump together and essentially create a roadblock, preventing healthy blood cells from passing through. When this happens, sickle cell patients will experience symptoms such as swelling of their hands and feet, frequent infections, and periods of excruciating pain called sickle cell pain crises. This pain can be so severe that it's often compared to the experience of breaking a bone or giving birth. Unfortunately, many patients have reported their pain is often ignored, dismissed, or categorized as inappropriate. In other words, labeling the patient as a drug seeker. There are a lot of myths and misconceptions out there about sickle cell. For example, I'm sure many of you watching this believe that sickle cell disease only impacts a certain race. This is simply not true. Sickle cell disease can affect people of any racial or ethnic background. While it is more prevalent in individuals of African, Mediterranean, Middle Eastern, and South Asian descent, it can occur in anyone. As I mentioned, sickle cell is a disease that developed as a natural response to protect against malaria. This is why sickle cell is more common in regions where malaria is prevalent. Remember, sickle cell is a genetic disease. If one or both of your parents have sickle cell, you are also at an increased risk of developing it. Sickle cell disease is a complex condition impacting individuals from various racial and ethnic backgrounds, from regions with high malaria rates. We need to foster an understanding of how the disease originated, who is likely to develop it, and break the notion that this is a Black disease, since this belief can leave some patients undiagnosed. It is vital to continue raising awareness of this disease and emphasize the daily challenges sickle cell patients face in managing their condition and in accessing treatment for sickle cell crises. We need to promote bias awareness when managing pain crises. A recent study by the National Proceedings of Science reported doctors in training believed Black patients were less sensitive to pain, which directly impacts the care Black patients receive. This can mean that with a condition as painful as sickle cell pain crises, Black patients are forced to suffer much more than they should. If you want to learn more about sickle cell disease, check out the Dreamsickle Kids Foundation and Adult Sickle Cell Disease Foundation of Nevada. I will leave the links for them in the description. This is Dr. BCW. Thank you for watching Beyond Clinical Walls. Don't forget to subscribe and turn on notifications so you don't miss my next upload. If you found this information helpful, please hit the thumbs up and leave a comment. It really helps the channel. Thank you for watching and thank you for your support.